Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. USG. So under USG, the USG it uses the 2 to 15 megahertz. 2 to 15 megahertz is that what is used. And the USG is a better investigation to differentiate between the solid versus the cystic. The solid versus the cystic lesions. This is what is used. So you have air and the calcification appears white. So air and the calcifications, it appears white. Next is the fluid. If you see, it appears dark. The fluid appears dark. And if there are echoes within the hypoechoic regions, so there is echoes within the hypoechoic. So hypoechoic lesions. So it could be pus. So this could be pus as well as it could be the hemorrhages. So it helps to differentiate between the simple and the complex cyst. Next is the pleural effusion. So it also helps to differentiate the pleural effusion as well as versus the emphyema. So emphyema as well as the pleural effusion. Now looking at the posterior acoustic shadowing. So in case of posterior acoustic shadow. So posterior acoustic shadowing, what is seen? So here the posterior acoustic shadowing, what appears black? So black will be the stones, then comes the bones as well as the presence of the air. Next is the enhancement. So enhancement means that it is completely white in color. So this includes nothing but the cystic lesions. To learn and grow daily like this, please do subscribe.